Yeah, so we've observed over the last couple of years that almost every year we have some sort of change in some particular subgroups of patients with CLL, and depending on new data that's coming out from phase 3 studies, we are always adjusting a little bit our treatment recommendations. So at the moment, what we can definitely state, and I think this is also reflected in most, if not all, national and international guidelines, is that particularly in the frontline setting, the treatment with continuous BTK inhibitors, such as ibrutinib or most recently acalabrutinib, is a feasible treatment option that has shown that it is at least as effective as chemomonotherapy. So this was the common comparator that was used in all of those phase 3 studies. And so we can say for sure that almost any patient with previously untreated CLL can have a BTK inhibitor as a frontline treatment. So there's nothing wrong doing that. And what we've now additionally seen with the data that came up from CLL14, but also from the Murano study in the relapse refractory setting, is that by using a treatment with a venetoclax backbone, so a BCL2 inhibitor, as a crucial part of a fixed duration treatment, we can also now treat patients not in a continuous fashion, but rather with a fixed duration treatment as established in CLL14, where we had treatment schedule that went over 12 cycles, and in the Murano study for relapse refractory CLL over 24 months. And so we now have basically these two treatment principles of continuous treatment versus fixed duration treatment, and MRD is one of the big distinguishers between those two paradigms, given that the continuous treatment does not really target minimal residual disease or does not eradicate it, but still achieves very good disease control, whereas the fixed duration approaches, their main aim is to get the patients into a very deep remission at the first shots, and afterwards allow the patients to come off treatment, given that they have achieved a deep remission, and therefore ensure that the patients do not need to continue to take treatment and to benefit from a treatment-free period.